So it makes life very, very simple, okay? I'm gonna run down the same list that you are, and I'll give you the numbers so you have them here. And then what you should do is take the information from here, look at the mid-sagittal, the sagittal sections of the head, and you can match up what goes here to here, okay? Yes? Yes, okay. External nares, that would be number 1. We're not writing the 1 down, correct? Because we know where our external nares are. She's writing it down. Don't be writing it down. It's 1. I'll look over here. Okay. Then you have the 3 nasal concha, okay? On this particular model, it's the 3 bumps. You have superior, middle, and inferior nasal concha, okay? These are the 3 ridges that are inside the nasal cavity. On this model, they're not numbered. There's just a big 3 that's on the middle nasal concha, but it's the 3 bumps, okay? Obviously, the top one is superior nasal concha, middle nasal concha, inferior nasal concha. So when you breathe in, air passes over them, okay? Frontal sinus. There's a number 43 with a little arrow pointing to the frontal sinus, okay? Named for the bone, so it's part of the frontal bone here. Number 44 is the sphenoidal sinus, okay, which is the sinus that's inside the sphenoid bone. Again, you can see they're open space, there's air inside of them, okay? Okay, the pharyngeal tonsil is not numbered on the flap panel, but if you go to the posterior section of the nasal cavity, run your finger on the wall, it's kind of bumpy, okay? Those bumps, that's the pharyngeal tonsil. It's right here. It's just below where the sphenoidal sinus is. It's like a pinkish red color. Again, at the posterior section of the nasal cavity, okay? The pharyngeal tonsil is your adenoid. Same thing. The nasopharynx is right where the number 4 is on the flap panel. Okay, so there's a number 4. Incidentally, the pharyngeal tonsil is just above it. Okay, that's the nasopharynx. The hard palate. Again, I don't know that there's a number on it. There's a number 9 right above it. The hard palate is the roof of the mouth where there's bone tissue. Okay, and then 9A is the soft palate. So this is the hard palate right here. Okay, think the roof of your mouth towards the front. And then at the back you can see it's tissue but no bone. That's the soft palate, that's 9A. The very tip of the soft palate, if I put a pointer right there, that's that thing dangling in the back of your throat, your uvula. Okay? It's the very tip of the soft palate. Okay, so your hard palate, soft palate, uvula at the tip. The oropharynx is number 5. It's the part of the pharynx that it's at the posterior segment of your oral cavity. Basically, it's the back of your mouth. Okay? So the nasopharynx is number 4. The oropharynx is number 5. The palatine tonsil. I have to show it on here. Okay, because I don't have it on the flap panel. The palatine tonsil, can everybody see this? Where my finger is, that's the tongue, okay? So we kind of trace along the tongue. Here's your hard palate, soft palate, and the uvula, okay? Does everybody see that? Just below the uvula. On all of these, there's a little bump of tissue. That's the palatine tonsil. That's the tonsil when someone looks in the back of your throat and says, ooh, your tonsils are swollen. That's the one they're looking at. So think about where they'd be looking, in the back of your mouth. Okay? It's part of the oropharynx. It's right there. So on there, right there. Like a bump right in the oropharynx. Palatine tonsil, the easy way to remember is your palate when you eat. Tongue, palate, palatine tonsils behind the tongue. Okay. What's next? Laryngopharynx. On the flat panel is number 6. Okay. The laryngopharynx is going to be the space where the pharynx is now going to touch the larynx. So laryngopharynx. So the nasopharynx is 4. The oropharynx is 5. The laryngopharynx is 6. The whole thing is your pharynx. It's just divided into regions depending on where you are. Okay? Your hyoid bone. Where's your hyoid bone? Okay? On this model, I'm not labeled. I'll show you on the hyoid bone. Yes? This is the only bone that's not what? It's not articulated as anything else. I always give that as like the little hint, see? You can separate these. Hyoid bone, okay? Your larynx, okay, there's different parts. I'm gonna read them off on the numbers. Okay. The laryngeal prominence is number 15. That's your Adam's apple. So when you swallow in men, it's pronounced. It's the bump that's coming out towards you. If you rub your finger on it, you can feel it's kind of like a peak. It's number 15 on these. The epiglottis is number 14, okay, which is here or up there, same. The thyroid cartilage is 16. Okay, so right here and right there. The cricoid cartilage is number 17. Okay? So, the laryngeal prominence is 15. 14 is the epiglottis. 16 is the thyroid cartilage. 17 is the cricoid cartilage. Your vocal cords are 18 on the flat panel. Now you can see all of these structures close up on this. So if, this is just bigger, it's the same thing. This ridge in the front, laryngeal prominence. These pieces on the side, thyroid cartilage. The piece underneath, cricoid cartilage, hyoid bone, epiglottis, and these are vocal cords. Okay, it's the same. It's kind of nicer here because it's big. Okay? Okay. The trachea is where? This one or that one? The first one, trachea. Okay? 19. Primary bronchus. Okay, in this case you have to do left and right, okay, because you have to a left primary bronchus and a right primary bronchus, okay? The bronchi collectively are the ones going into the lung. So here's the trachea, bronchus, bronchus. So you have 20 and 23. 20 is the left primary bronchus. 23 is the right primary bronchus. Okay. Secondary bronchus would be on the right, number 24 and 25. And on the left, 21 and 22 are secondary. They branch off of the primary. So on the right, it's 24 and 25. On the left, it's 21 and 22. It follows the sequence. Primary is 20, secondary is 21 and 22.